As everyone around here knows, there's something about Dr. Marie Savard that makes you learn all the answers to your questions from her. Whether they're personal, whether they're tough ones, we surround her every day, get our medical checkup. Well, now she's going to answer even more questions in a new book called Ask Dr. Marie, Straight Talk and Reassuring Answers to Your Most Private Questions, proving that nothing stumps her, that she does not steer away from anything, taking on pressing medical issues. Everyone wants an answer from Dr. Marie Savard. At GMA, people line up in the green room armed with their medical questions.
Lately, I've heard a lot about fibroids.
First, the good news. Fibroids are so common, and they're benign. They don't cause serious problems for most women. It's just a growth in your uterus. If you don't have symptoms, don't be talked into having surgery.
I just heard about the new NuvaRing. What's the difference with that and birth control pills?
The NuvaRing is a form of birth control that you take, you actually insert inside, and it gives you the hormones directly, right into the bloodstream. The ring you can keep in for 3 weeks, and then take it out for a week. The pill you have to take every day.
Even the guys have questions.
How do you know when a woman is going through menopause?
Menopause means a woman no longer has her period, and a doctor defines that by 12 months. Women often ask, is there a blood test? There is a blood test that can help the doctors decide, but it's not totally reliable. So often we just ask a woman her symptoms.
People even stop her on the street.
Is it safe to smoke and take birth control pills at the same time?
It's never a good idea to smoke and take birth control pills. But I would say first, think about stop smoking. Most important thing. Smoking and taking the pill can raise your risk of blood clots, heart attack, even stroke.
I'm breastfeeding my 8-month-old and still haven't gotten my period. Does that serve as birth control?
You know, a lot of women think that breastfeeding is a protection against pregnancy. It's not. Even if you're not getting your period, which is normal when you're breastfeeding, you can still get pregnant.
And Dr. Savard joins us now. Again, her book tackles everything from the bedroom to sex after menopause. We're going to talk about some of these issues. A bit of a warning to you if you're concerned about that. How did you decide to write a book about a lot of really personal things, many of them sexual?
Lots of stuff that's in this book are the kind of embarrassing things that patients didn't even ask me many times. I think I didn't have enough time, I was rushed. But now, in the craziest places, I get such private, personal questions. And furthermore, I experienced a lot of the things, and I knew some of my own thoughts in terms of what the answers were. So I thought I'll put pen to paper and give women all the time they need and all the answers that they really deserve.
Let's start with one category. You talk about sex for women re-entering the sexual world after a while. So these are women in middle age, late middle age, and sex. What are the first things you say to them?
Well, first of all, I say thank you for even asking, because they're embarrassed about it. But they said, you know, I'm thinking I have a new partner. More and more women, that's happening. And they don't know that they have to, that they used to think about pregnancy, that's the only thing. So a quick checklist, think about HIV. We all need to have an HIV test. Universal screening is important. Give your partner a copy. He gives one to you as well.
No matter what the age, make sure you're doing the HIV test.
20% of the cases, new cases, are over 50, believe it or not. So that's surprising. It should be universal. Second, just ask about other partners in the past or other sexually transmitted infections. Do they have herpes? Have they had any other types of infections? Being forewarned.
That's so hard to do. How do you say hello and do you have herpes?
Well, I don't think you should be having those bedroom questions in the first date anyway. And then finally, a condom. Don't forget, it's not just about pregnancy, it's protecting you. More and more women are getting sexual infections at older ages. They need to be informed.
So don't think just because you're past 20 years old that you can't get all of these things. Okay, low libido, lack of desire.
I think that is the most common and hurtful and really hard question for women to ask. There are things that I say, the brain that is involved and the body. For the brain, at a young age, well, first of all, the brain is considered the largest sex organ of the body. I'm sure you've heard that before. Young women, they're busy, they're childbearing. You saw the woman in the tape, she had 3 young kids. They don't have time. Older women, they often are part of the sandwich generation, worrying about their parents and their children. So that's the brain stuff. But then there's the body stuff. Look at birth control pills. Believe it or not, that can actually act as a sponge to soak up some of the testosterone so that you don't have that libido. People are surprised to hear that. Alcohol, too much alcohol, actually can kind of blunt your libido. And finally, antidepressants, other medications can do it. And then hormones and prematurely going through menopause. It's really a big concern for women. There's not a great treatment out there. I talk a lot about testosterone. what's safe, what's not safe, some things that they can do to kind of boost a libido.
One of the things that you say is people, particularly women, I guess, have a hard time asking you about orgasm and what to expect and not to expect. How do you approach it with them?
Well, women want to know what is normal, and who do you ask? What does it mean? We all sort of were trained in medicine to believe that it's actually good for us, but we never really understood it. We're never really told that much about it. I think women, the sexual response can be so varied in women, and I say if you don't think you're having a problem, if you enjoy sex, that's good enough. Don't let someone else define it for you. Some women are very sensitive, some women are much less sensitive, and I think we're all different, but practice makes perfect. Believe it or not, that's why sex therapists can be incredibly helpful. They can help you learn how to do it.
And what do you say to women about pain, discomfort after menopause in sexual relations? Can it absolutely be eliminated?
Well, we know that women are afraid to talk about that and think there's nothing that can be done. But actually, when we lose estrogen, the lining thins so much it can even tear, and sex can be painful. This is one time I talk to women. Yes, there are short-term remedies, over-the-counter, Replens, KY jelly type products. This is one time estrogen can work. Locally, topically, put in a tablet or estrogen cream. It can really thicken up the membranes and help. Hot flashes might disappear, but these complaints will only get worse as you get older.
And one final quick one here, because you put it on a list of most asked questions. Can you pass a yeast infection to your partner?
Yeast infections are so common, and women quickly go to the drugstore and think they're, solving everything by just popping that prescription that they can easily get. They do want to know, is it okay if I have sex? Can I infect my partner? Well, guess what? Yeast infection is common. You can pass that on. Not a big deal, but again, sort of it makes sense to let your partner know, and you can make a decision whether you want to kind of hold off. You're probably uncomfortable anyway, or not. It's not serious, but again, be upfront, be comfortable, laugh, and don't be embarrassed. That's the point of this book. Talk about down there issues a lot more. Don't use the word vajayjay. Let's not use baby talk anymore. Let's talk real words and real sense. We need to train our children that as well.
And also real solutions. If you have anything that's worrying you, you don't have to feel alone. You can go to Dr. Marie Savard's book, and there's an excerpt of it, by the way, on abcnews.com. Let us know other questions you might have. She'll answer them too. Thanks, Marie. And coming back.